Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about intrauterine growth restriction. You're measured at each prenatal visit to see how your uterus and baby are growing. If your doctor measures your uterus and finds little to no change over a period of time, your doctor may be concerned about a problem. One of those problems is intrauterine growth restriction, IUGR. IUGR indicates a fetus is small for its gestational age. Weight is in the lowest 10 percentile. There are two types of IUGR. With symmetrical IUGR, all parts of the baby's body are small in size. Asymmetrical IUGR indicates baby's head and brain are normal size, but the rest of its body is small. IUGR may occur because the fetus doesn't get enough nutrients and nourishment. This can happen if there are problems with the placenta or blood flow in the umbilical cord. Tests may be ordered. The first test is usually an ultrasound. It helps your doctor estimate the fetus's size and weight. Your doctor may use another ultrasound to check blood flow to the placenta through the umbilical cord. Ultrasound may also be used to assure baby is healthy and no malformations exist that must be dealt with at birth. There can be many contributing factors to IUGR. If you have pregnancy complications, it may contribute to the problem. Expecting more than one baby may result in growth restriction of each fetus. Preeclampsia and high blood pressure can also affect baby's growth. Some infections in you may restrict growth in the fetus. Anemia may also be a cause. Various lifestyle choices can raise your risk of IUGR, including smoking, alcohol use, eating disorders, and drug use. And if you don't gain enough weight, baby may have restricted growth. If the cause of IUGR is a problem in you, you must be treated to improve your health. Your doctor may recommend bed rest. Some problems at birth are associated with IUGR, including heart disease and hernias. Baby may also be at higher risk of a genetic disorder or birth defect. Infants with IUGR may not tolerate labor well. Baby may need to be delivered early and stay in the hospital longer. Baby may also need special care in the neonatal intensive care unit, also called the NICU. The long-term effects of IUGR on a baby may depend on the condition that caused the problem. Other problems may arise in baby after birth that can be related to intrauterine growth restriction. These can include problems with breathing and feeding, trouble keeping a steady body temperature, abnormal blood cell counts, low blood sugar level, problems fighting off infections, and neurological problems. If you're diagnosed with IUGR, follow your doctor's advice. Go to all your prenatal visits and testing appointments. You also need to take good care of yourself. You can do this by eating a healthy diet, getting enough sleep, and avoiding alcohol, drugs, and tobacco. Detecting IUGR is another important reason to keep all your prenatal appointments. Each time you're measured, it helps your doctor determine how baby is growing. This is very important for the good health of your baby. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be.